that I would. Thank you. Okay, sorry. I'll just quickly reintroduce myself. So, hi guys, I'm Alana. I was event coordinator for the pre-med community for the last 2 years, but I am an advisor for the club right now. And I actually graduated from UCLA last year, and I'm going to medical school in the fall. So that's why I came back to sort of give this presentation about med school interviews. And I'm going to just be talking about the MMI because I actually went through like the interviews and the MMI process. And yeah, so we're just going to get started. So, oh, I'm not sharing. Okay, perfect. Thank you. Uh, so what is the point of an interview? I know this seems like pretty basic, but it's always good to understand what the point of an interview is before you like go into an interview. First and foremost, it's just a way for the school or the interviewer to get to know you on a basis that's more extensive than what you put in your application. And what this means is that you just want to show off like qualities or experiences that you have that they couldn't necessarily get when they're reading just like you on paper. Basically, when you have an application, you list a bunch of things, but that doesn't really like necessarily show who you are. A person can tell a lot about another person when they're actually talking to them in person and asking questions. So it's just another way to for you to like demonstrate your experiences or more detail about like what you put on your application. And also they're trying to find like what qualities you possess and if whether you're a good fit for the school. And also interviews are also a good way for you to like get to know more about the school if you have the opportunity to ask them questions and stuff. So I'm just going to give first tips for in-person interviews because ever since the pandemic, a lot of interviews have switched to online, but there are still like some in-person interviews that are still happening. So first thing for in-person interviews, you want to dress in professional business attire, which, I know may seem shallow, but appearances do make impressions and they want to just see that you take this seriously and have put in the effort. So if you have an in-person interview, it's just important to like present yourself appropriately and not like come, in sweats and stuff, which is totally fine if you want to like wear sweats to a grocery market, but maybe not necessarily wear it to an interview. Um, but yeah, just make sure that you're like in professional attire. But also it's important to like just play by ear. Typically medical school interviews are like professional attire, but some jobs like you can totally just show up casual, like depending on the interview and like who you're interviewing with. But a medical school interview is definitely important for professional attire. And another tip is just to get plenty of sleep the night before, because you don't want to come show up like tired and unprepared and looking tired. And also like if you're more tired, you're more likely to just be nervous. And when you get enough sleep, it's just easier for you to like be confident and answer questions smoothly. Also, you want to make sure that you're like reading all the directions and any information that they give you about the interview because you don't want to be late and you want to arrive a bit early. So make sure that you understand all the directions that they're giving you and just avoid nervous tics. I'm kind of doing a bad job with that because I keep using my hands to talk, but like, yeah, definitely avoid nervous tics like saying or like or fidgeting in your seat. I doubt they would notice it, but it could be distracting to some interviewers. So like try to avoid using those sort of tics. If you can't, it's fine. I'm really bad at it. You probably will hear me say like about a million times in this presentation. But anyways, you want to concentrate on your interviewer. Make sure that you're giving them your full attention because that just shows that you are being respectful of their time because they took their time to come meet with you and actually interview you. So if you're like looking around or God forbid even looking on your phone, like it doesn't really give a good impression. And again, you just want to be yourself, be calm, answer the questions in a way that makes you seem like a human being. Like don't be robotic, don't just give out scripted answers. Just answer the questions as honestly as possible and give them like sort of a sense of who you are. And then for online interviews, basically all the things that I said for in-person interviews apply. Still dress in professional attire, get enough sleep, make sure you're rested and you've eaten before the interview and all that. But just some specific instructions for online interviews. first of all, you want to find a good setting. For example, you want to be somewhere like clean and well lit, and then with little distractions. So if you're like working on a desk, you want to make sure that you sort of declutter the desk, not just for your not just because they might see the clutter, but like also for yourself. Like if you get distracted by clutter and you just want to have like a clean environment. Um, and then also you want to make sure that you're having a working camera, microphone, and then internet service beforehand. And also just like silence your phone. And if you live with people, it's important to just notify people in advance, like if you're doing an interview, just so you can have like a quiet setting. Okay, next slide. Thank you. Okay, so two types of interviews you'll see. You'll see the MMI, which is the multiple mini interviews. And that's like the big scary one that people are usually scared of. And so what the MMI is, it's a 6 to 10 minute interview. Sorry, no, a 6 to 10 interview stations, basically with a question per station. So it's very structured and formatted, meaning you're just going to go through station per station, and each interviewer will have a different question that they're going to ask you. So basically, you'll have about 2 minutes to look at the question beforehand, and then 5 to 8 minutes to answer the question that they give you. And then if you finish early, they'll have follow-up questions, so you don't have to worry about taking the whole time. But if you do take the whole time, that's also okay, as long as you're answering the whole question and just being very concise with your answer, and pretty detailed when it comes to like answering what the question wants you to answer. And while personal questions will be asked, they sort of lean more towards personal stories and scenario-based questions, and I'll talk about those different question types later on. But definitely a pro for the MMI is that it's designed basically to just eliminate or like limit bias, because you're seeing multiple interviewers, and you're also they also have sort of a strict rubric that they're given to judge each question that you're answering. So because of this, it limits bias when you're going through the interview process. And it can also provide more reliable feedback on the candidate. But the cons is that it can be stressful because you have less time with an interviewer, and it's also like less personable because, again, you have less time with an interviewer, you have specific questions that are set, so you don't really have enough time to talk more about yourself, or for the conversation to really like go away to like conversations about yourself, because a lot of the questions could be scenario based. And so the second type of interview you'll see besides MMI is, again, the more traditional interview. It's the interview type that you like sort of picture when you hear like interview. Like it's like sort of like a job interview, interviews for clubs and that sort of thing. So basically you'll just have like typically one interviewer, but it could be more than one interviewer, but usually you'll have more time with certain interviewers, and it's definitely, you probably definitely won't have 6 to 10 interviewers like you will with the MMI. So for these questions that they'll ask you probably will be more personal based, because they most likely will just be asking you the questions rather than you actually looking at the questions. So it won't, I mean, they could still give you scenario based questions, but those are less likely for these types of interviews. And again, it's less structured. So if they find a certain topic about you fascinating, they might start asking you more questions about it. And again, a pro for this is that it's more flexible and more personable. So you can have more time with an interviewer and really be able to like talk about yourself. But cons is that, again, it can be more biased because you're having fewer interviewers and they can basically switch topics of what they want to ask you. And this is a con because, again, like there's some stories of where like some students have gotten interviewers where they really just didn't click with, or like interviewers that really like were sort of unprofessional and that like sort of sucked. But yeah, if you do click with your interviewer, that's a good thing for those types of interviewers. Interviews. Okay, so now we're going to go through the 3 common types of interview questions. Yeah, next slide. So the first type of interview question is the straightforward personal question, which is the most common. on a typical interview, like I said. So for these types of questions, it's just, basically straightforward. They'll ask you some sort of personal detail about you, and you just want to answer straight to the point. But also like provide maybe some explanation, reasoning, or details to accompany your answer if that's like necessary to make it complete. For example, if you're asked like what your favorite book is, then you don't want to just like state what your favorite book is. You want to like, maybe state why, or like what about the book is meaningful for you. You don't want to just like give like lists of answers, because that doesn't really say much about you. And again, you don't want to give generic answers. You want to try to be detailed so that you can give sort of a good insight on who you are to your interviewer. The second types of questions, which is common for both interview types, is like the personal story. So for this, you'll just like be given a question where the interviewer will ask to give like an example of a time or like situation or experience that you had where you had to demonstrate certain qualities or deal with like certain problems or make difficult decisions. And the best way to prepare for these types of questions is to just prepare in advance, like a story bank that you could just pull from, to answer these types of questions. So you want to around like maybe 10 stories or so that you can talk about in detail, where you like dealt with a certain person that was like being difficult, or like demonstrated leadership, or so on. And to answer these questions, it's usually like best if you like just follow these steps. So first, you want to clearly and clearly just like summarize your story in a way that answers the question. So for example, if you are asked about a time that demonstrates leadership, then you want to just like talk about the scenario and then explain how you demonstrated leadership. And then the second way is you want to explain any challenges you faced or how you overcame those challenges if applicable. So like if you had challenges in demonstrating leadership, you want to like explain that as well. And then you always want to explain how you learned from the situation or how you grew from the situation, and how you can possibly improve your approach in the future, and how you can like apply those qualities to future events. Okay, so then the third type of question that you'll see, which is again most commonly seen in the MMI, is the scenario type question. So during these questions, you'll be provided with a fictional scenario where you'll be asked how you would respond and interact with the fictional characters involved in the scenario. And so during these questions, you want to answer typically in this way. You want to summarize the scenario in order to show that you understand what the issue is and what you're being asked. And then you want to show that you understand how the situation impacts each person, and you want to show that you actually empathize with the people involved in the scenario. And then one important thing is you want to explain what possible information you're missing in order to make an informed decision when it comes to dealing with the situation that you're given. And then finally, you want to explain and detail multiple solutions and how you can implement these solutions when dealing with the situation. So now we're going to go through some practice MMI questions. And these are just practice ones, so you don't really have to form your own response, but I gave some like sample responses later, so we can possibly read through those and go over that. So the first question is, an 18-year-old female arrives in the emergency room with a profound nosebleed. You are the physician and you have stopped the bleeding. She is now in a coma from blood loss and will die without a transfusion. A nurse finds a recent signed card from a Jehovah's Witness church in the patient's purse, refusing blood transfusions under any circumstance. What would you do? You don't have to go to the answer yet. Maybe we could just talk in a group and explain like how to go through this. So does anyone want to like just summarize what the situation is for me real quick? If you want to just unmute yourself or type in the chat.
So I guess it's a like life-threatening situation where the patient could be saved if she gets a blood transfusion, or she will die without it. But the thing that's making this a conflict is that there's a signed card that says that she does not want any blood transfusions, but you can't really talk to her since she's in a coma.
Yeah, exactly. So does anyone want to like go over how each person in the scenario is like impacted? for the next step?
I would say obviously the patient, there's this uh impact of like her health and her life is at risk. And then there's also the like you like us or the person who's in the situation, the physician in the situation. And we're impacted in like, do I save this patient's life by performing a blood transfusion, or how do I respect like um whatever she like the fact that she needs to consent to this, and that she's unable to. And then also I think it's interesting to think about the nurse as well, because the nurse found it, and so the nurse could play a role in affecting the decision. And like the nurse could have also chosen to keep it to themselves, but they brought it out, so they also play a role.
Correct. Thank you, Gabby. So does anyone want to explain if we need any more information in order to make a proper decision? No?
I personally, I don't know too much about Jehovah's Witnesses, but I think since it's a more religious thing, I feel like I would need to know like the reason behind it. Because sometimes with regards to religion, there are certain reasons behind certain things, so there may be exceptions. So like finding out more about that, I think.
Yeah, no, I think that's a good answer. Like you can find out more about if you don't necessarily know exactly what about Jehovah's Witness, like why they refuse blood transfusions and you want to make a decision, then I think that's like a good way to proceed. And then also you want to see if like the patient has like any living wills, because not all Jehovah's Witnesses, sometimes they'll put that they still want a blood transfusion even though they practice the faith. So you want to like make sure that they have any living wills, or they have any relatives that are able to like make a decision for them as well, or know what the patient would want. So that's sort of information that you want to gather. Um, does anyone want to give sort of any solutions for this scenario? For the what would you do? It's okay if you don't. We have the sample answer, so we can go through that if you want. Okay, if you want to switch the slide. Oh, sorry, David, did you unmute?
I was gonna just suggest talk to the parents to get some input
Okay,
because
yeah, no, that's
they're probably in the same church probably, and they hold the same religious views, and they have a lot of trust in the family. So probably resulting to the parents might be a good idea to get a start as to why like refusing blood transfusions is like not accepted, and maybe they can work around that.
sure. No, yeah, that's a good answer. So yeah, if you want to switch to the next slide, we'll see. And again, these are just sample answers. You don't necessarily have to answer the way that are given in sample answers, but they are like good answers that are provided that people have given. So if you have different solutions from this sample answer, then that's also totally fine when you're answering questions in the MMI. All questions are usually designed to be answered differently, so don't stress if your like answer doesn't match with someone else's. But yeah, basically, again, they just talk about. I'm not going to read all of this because it's very long. But did I just? I think I copied and pasted the wrong answer in. Sorry. My bad. Yeah, I did copy and paste the wrong answer for the different question. But basically, okay, so we went through the yeah, sorry. I'll fix it before we share the slides at the end, later on. I'll put in the right answer. But yeah, if you guys want to just go to the next question, I'll put in the correct answer later. But sorry about that. But basically what we went through, that's a pretty good way to like tackle those sort of questions, those situational based questions. So the second question is, a couple has decided to have a child through artificial insemination. They ask the physician for sex selection of the child. What should a physician advise in this situation? So again, this is a situational based question. So does anyone want to summarize what the sort of situation is in their own words? Okay, I can go, it's fine. So basically this situation is whether, well, it's a really short situation. So basically what's in the question is the situation, but it's always helpful to like summarize in your own words when you're like repeating back to an interviewer. So basically, you'll just talk about how you're the physician, so you're trying to advise whether a couple should go through sex selection, and if there's any like reasons for them not to, or like any moral reasons, or like any like harmful ways that could like you know, I'm sorry, my words are not correct today, but basically you just want to summarize when you're answering this to an interviewer, you want to like just summarize the question, the situation to them before you get into like the advice that you're giving. So then we're going to go with like who's impacted. Well, first of all, you obviously have the couple that's impacted because they're the one who is going through the artificial insemination. So obviously you want to make sure that they understand the procedure and they understand what they're going to be going through and any costs or benefits of what the procedure is going to be doing, and what exactly it means for sex selection. And then another person that is affected is, you know, the child. Is there any like harms to it? Is it a safe procedure? As far as I know it's like for sex selection, you know, you do it even before the conception happens with the egg and the sperm, but basically I think that's safe. But you can just go through like those sort of situations if you know a little bit about that, and then you want to go through physician advice on the situation. And so does anyone have an answer of what they would advise the patients before they make a decision? No? Okay, we can go to the next. I think I put in the correct. Okay, yeah, perfect. So I put the, did I put the wrong question again? Oh, no, sorry, this is the, okay.
Yeah, I think it's the
Oh,
wrong
no,
question.
sorry, that's weird. I swear I clicked on the right like questions when the answers, but okay, basically, um, yeah, sorry about that. That's my fault. I'll put in the correct answers later on, but basically, yeah, you just want to like go through the steps of summarizing what the situation is, talking about who's impacted, and then going through possible solutions. Okay, next question. And obviously this one doesn't have a sample answer because it's just like, if you didn't do medicine, what would you do? So this is just an example of like a personal question that you would answer. And you guys don't have to answer that, but that's just like an example. Okay, final slide. So the other tips is that, of course, you want to research the schools that you're interviewing extensively. And this is just because for the MMI, you'll have set questions, so maybe you won't be necessarily be asked about the school. I mean, sometimes you will be asked about the school, but for traditional interviews especially, you will be asked like why you're interested in the school sometimes. So you want to just make sure that you know about the school, like what programs that you're interested in, and whether you're a good fit and what you can offer by attending that medical school. Another way to prepare is, again, to prepare those personal stories that you can choose from. And this is because when you're given sort of those questions about talking about certain events or experiences that you have, it's very difficult to come up with things on the spot. So to have that like story bank is very helpful for when you're choosing to answer these questions, no matter like what you're given. Another tip is to ask the interviewer questions. And again, for the MMI, that's kind of not really possible, but for traditional interviews, if they're like giving you an opportunity to ask about the school, then you know, take that opportunity, because for the interview, it's not just about them getting to know you, but also you getting to know the school more as well. So you want to make sure that the school is a good fit for you, and you can do that by asking them questions. And then you also want to be able to explain everything that you listed in your application in detail, and maybe expand on that, because you'll be expected to know what was on your application. Like if they ask you something specific about your application, you don't really know what they're talking about. That doesn't really like look good, because you want to be able to explain everything that you like listed on your application. And then finally, just like be calm and be yourself. If you have a bad interview, don't stress. you know, the interview is not the only portion of what they look at for admissions. You know, it is, you know, it is a portion of it, but like people have bad interviews. If yours went badly for some reason, it's not the only thing that they look at, and maybe other parts of your application will stand out to them and it'll be fine, or maybe you just weren't a good fit for the school and it worked out anyway that it was a bad interview. So again, don't stress. But yeah, that's all the tips I have. So if any of you guys want to leave now, you can, but we're also going to be going through more MMI questions in certain stations if you want to go through like sort of a practice MMI thing. I think the only one we really have that's a member is David. So if you want to go through this different stations and you want to do the practice, we can totally set that up for you. Just let us know.
Sure, if you guys have time.
No, yeah, we have time. We can prepare that.
Cool.
So